welcome to today's Healthcare IT News HIMSS and MHIMSS webinar, Mobile Solutions for the Modern Hospital, sponsored by Formfast in McKesson. With the widespread adoption of mobile technologies, many stakeholders in healthcare wonder exactly where there are opportunities to use this platform to improve the industry. Exploring the subject, thought leaders from Formfast and McKesson will offer insight into the need for mobile solutions to increase the quality and operational efficiency of hospitals. Our first speaker today is Patrick Gardner, Executive Director of Product Management at McKesson. He's held leadership positions within Linear Healthcare, MedQuist, SoftMed Systems, and McKesson. To his credit are the creations of innovative solutions that address the life cycle of medical record documentation for acute care hospitals in the U.S. and around the world. He has more than 20 years of experience in health IT and health information management, with positions including healthcare sales, sales management, marketing, and product management. Recently, he won the 2012 Technology Association of Georgia's Product Manager of the Year Award. Our second speaker today is Sean Curtis, Director of Product Management at Formfast. Sean is a professional in the field of healthcare IT solutions with extensive expertise involving solutions for operational process improvement. Having served as Director of Product Management and Solution Architecture at Formfast, he's helped create solutions that empower hospitals to perform more efficiently and eliminate waste. And now I'd like to hand it off to Patrick to begin our presentation.
Well, thank you. Well, hello and good morning, or good afternoon, depending on where you are, and thank you for attending the webinar. I am Patrick Gardner, and I'm the Director of Product Management for the Enterprise Medical Imaging Document Management team at McKesson. I represent a team that fundamentally focuses on market and customer analysis to drive our product strategy and the specific market requirements that are needed to develop a strong portfolio of document and content management solutions for our target market, which is healthcare. Our solutions focus on health information management, or HIM, as well as other content-laden departments across the healthcare enterprise, such as HR, legal, etc. During my presentation today, I will likely mention just a few times the importance of keeping our customers at the forefront of our planning in all cases, because I firmly believe that our customers are the absolute best at determining the business problems so that we as an organization can help solve them. One of the emerging areas in health IT that we see in nearly every trade journal these days is the topic of mobility, which we will focus on today's discussion. But specifically, we're going to focus around how we as a company delivered a mobile solution to our customers and the decisions that were required for us to do so, and how a mobile solution fits into our patient folder product strategy. Patient folder, of course, being our electronic health record that allows HIM, or Health Information Management departments, to maintain what is referred to as the legal health record defined for disclosure, all while, of course, managing the document lifecycle through powerful and robust workflow. So in today's webinar, we'll focus on 5 primary areas. They are a persona approach to mobility and how we focused our attention on a particular persona. Essentially, a key tenet of any mobile solution development project is the definition of that persona. We'll talk about that. I'll then explain how this concept of personas was used to define the scope of our mobile application. Next, I'll provide a brief description of some of the market dynamics that shaped some of our fundamental go-to-market decisions. I'll explain how we performed analysis of native versus browser-based applications and how the functionality relates back to the selected persona. And then we'll wrap it up, this section of the presentation, with a brief overview of the mobile solution, and I'll explain how you can learn more at HIMSS this year and beyond. So I'd like to start the discussion today with an explanation of persona mapping and how it relates to software development. One of the first questions that must be asked is, what persona are we going to address? And for our market and our solutions, we obviously have several of them to choose from. But we knew that we could not address them all, and in fact, no mobile solution really should. So to start our focus, we began with a mapping of a series of key functions performed by each of these personas to determine which of them lend themselves best to the concept of mobility and to a focused scope that would deliver value to the specific persona that was selected. So as we performed the analysis, one persona that seemed to stand clearly above the rest is that the persona, of course, of the physician, mainly because we were able to isolate a specific part of the functionality that drives value to the physician, and mobility is certainly an added benefit for the physician. So let me expand on that just a bit. For McKesson Document and Content Management Solution, the productivity of the physician is one of the biggest components that sits at the center of our workflow. And this is because fundamentally our solutions are focused on the revenue cycle, or more appropriately, the efficiency of the revenue cycle to optimize the completion of the medical record, which involves largely the generation of codes representing the diagnosis and procedures that were performed and documented as a part of the patient's chart. This is, of course, one of the areas that extends to the billing cycle itself, and then, of course, the eventual reimbursement of expenses by payers, which is why we ultimately consider this a component of the revenue cycle. So when discussing this cycle with our customers, one of the personas that they continue to bring up is the physician persona, mainly because they're looking for vendors like McKesson to continue to provide tools to allow those physicians to more quickly and easily satisfy what are known as document deficiencies, we'll talk more about that in a minute, that limit the efficiency of the revenue cycle processes itself. It adds to DNFB, the discharge not final billed, it adds to accounts receivable days, and really limits the cash flow for the facility. At the same time, both Health Information Management and Chief Medical Information Officers, or CMIOs, are very interested in improving physician satisfaction, and technology, or mobile technology in many cases, and the convenience that it provides is often a component that is driving this increased satisfaction. So to summarize, in developing a mobile application, our initial focus was placed squarely on the physician and the specific functionality required for deficiency completion. So as we explored the set of features and functions that were legitimate candidates for our mobile solutions, we quickly realized that the available functions in our solution follow the age-old 80-20 rule. That's to say 80% of the value driven to our physician persona is accomplished by approximately 20% of the available functions, essentially the Pareto principle. So we validated this concept with our customers, and as a result, we were able to limit the scope of our solution while focusing more heavily on user experience, ease of use, practicality of the functionality that's provided, and efficiency to the physician user. Once this research was conducted and complete, we had a very good idea of what our solution needed to provide and the value behind it, all of which provided us a clear direction for our project and a clear set of objectives when working with our customers to define features. And of course, throughout this, we continue to focus on the 20% of the functionality that drives that 80% of value to our customers. So I've mentioned this notion of deficiency completion a couple of times, and so I would be remiss if I didn't define that a little bit. But I would suspect, based on the attendees that are on this call, that most of you have a very clear understanding on what I mean when I say document deficiencies. But just to level set, there are fundamentally three specific deficiency types that are processed inside of a document completion workflow. First, there are signature deficiencies. Signature deficiencies represent documents that require a dictating physician, or more appropriately, the physician that provided treatment or observation of a patient, to sign a document, indicating that the content of the document represents an accurate and complete account of their thoughts and observations regarding the treatment or the observation of the patient. As an electronic health record, then, we as an organization provide the ability for these physicians to perform this task electronically and emboss, or what is called raster, an electronic signature on a document. This is a huge component of what physicians do with our solutions today, so we absolutely knew we had to have this functionality in our go-forward solution. Next, there are missing text deficiencies. Missing text deficiencies are created by chart analysts and coders as they work with the chart to ensure the complete assembly or that the documentation in the chart supports the coding required for the chart. When a missing text deficiency exists, the physician is presented with a text box in which they can add specific text to a document to provide a greater level of clarity required by the HIM staff. Interestingly, during our analysis, we found that the use of the missing text deficiency actually varies widely across our customer base. Some customers rely really heavily on its use, while others utilize the feature very infrequently. But in order to provide a complete set of deficiency management features focusing on the physician, we all agreed it had to be in scope. So finally, there are dictation deficiencies, or deficiencies that indicate that there is a missing document that needs to be created by a physician. In most cases, these deficiencies require the physician to dictate a report, which involves a telephone call into a dictation system for subsequent transcription by a transcriptionist. There's an age-old battle that seems to occur between HIM and the physician staff over whether or not a dictation was actually created, mainly because HIM is either not able to find the document that a physician absolutely swears they created, or there's some other reason. But for obvious reasons, most of our customers are interested in anything they can do to reduce the frequency of this discussion. So dictation systems long ago started providing confirmation numbers to dictating physicians to serve as their proof for tracking down their dictations. So to enable this functionality within our application, similar to what we do within WebStation, we needed to provide functionality to capture this number. But again, we conducted extensive research with our physician users to determine the day-to-day use of this feature to determine if it was enough. And what we learned is that there was an equally important feature that of also allowing the dictating physician to browse various documents within the chart during the dictation session, similar to what they would do if they had a paper chart right in front of them. So our customers basically stated that in order for remote, or more appropriately mobile dictation deficiency completion to be effective, the physician would need to access all documents in the chart, keeping in mind security and access, of course, all in an effort to improve their awareness of the information that is required to dictate the report itself. So simply capturing the confirmation number wasn't enough, and we would need to provide a whole host of other features that truly place the patient's chart at the hands of the physician at all times. As a byproduct, we later learned that this functionality was also valuable in other aspects of the solution as well, and so we had to make it extensible to other deficiency types as well, such as signature and missing text, where browsing the chart was also included or required. And as I mentioned earlier, I'm a huge advocate of our customer involvement in the requirements generation process, so this is a perfect case in point for why that's the case. And because of our customers, we now have a product that we feel is far more valuable to the specific persona that we're targeting. So once we had the deficiency completion as our focus, we wanted to prioritize the order in which we delivered functionality to the market. Part of this was a bit of a phased delivery approach to prove first and foremost that we could deliver a product within the Apple ecosystem. More on that later, which required a significant amount of learning in and of itself. But secondly, we wanted to get products into the hands of our customers to ensure that we had a solution that actually made the physician's life easier and created more convenience in completing their work. So through requests made to our customers, again, we were able to pull their patient folder databases to determine the occurrence of deficiencies to allow us to target specific deficiency types that represented the preponderance of what a physician would work on a daily basis. So the results were very clear, as you can see in the slide, and almost exclusively focused on the completion of signature deficiencies, which gave us the opportunity to get real-time physician impact by delivering that functionality to the market first. So based on the popularity of this functionality, we have since rounded out a full complement of features and functions around all deficiency types, which greatly improves on the addressability of our solution to our customers. So at the end of our analysis, our scope was rather clear. We were going to focus on the physician persona, and we were going to focus on mobility and the workflow specific for deficiency completion for that persona. So our next decision point revolved around platform, or more appropriately, what device or devices were we going to target as our deployment vehicle for our solution. As we scoured the industry for data, we found some rather focused research that helped us to draw some rather important conclusions. First, we had to wrestle with the question of the specific device on which we would begin our development efforts. We found some rather startling statistics on the use of mobile devices amongst physicians, which is somewhat hard to find because most empirical data on mobility seems to be cross-industry. So finding some information on the physician market was critical. But specifically, the research indicated that over 80% of the physicians in the U.S. healthcare market were users of some form of a mobile device. So this by itself was a promising notion to the development of the mobile solution, in that we knew that devices were already in place. We knew that bring your own device, or BYOD as it's come to be called, versus hospital-provided devices was going to continue to be a topic of discussion, but the proliferation of the mobile devices already in use greatly improved our ability as a company to deploy applications directly into the physician's hand. So the next question then was, which device? So predominantly the research also indicates that Apple devices and the Apple ecosystem have the lion's share of the market, specific to healthcare, which is estimated at over 75% of those physicians that actually use a mobile device. So with this, our conclusions were fairly straightforward. We were going to initially target the iOS platform and the Apple ecosystem for our first release to the market. Now that's not to say that we're turning a blind eye to the Android market. The industry data is showing slow emergence of Android popularity specific in healthcare, but there are still some concerns amongst customers we've talked to over fragility of the operating system, publicity around hacks, particularly when considering the notion of PHI and the increased expense required to support the Android platform, which quite frankly has many health IT vendors such as McKesson somewhat wary of the approach. But we're going to continue to monitor the progression of Android adoption, and we will react accordingly. So as you expect, our decision was to pursue Apple and the Apple devices, including iPad, iPhone, and the iTouch. So our next decision that we had to make focused on the delivery of a native application versus the development of a browser-based application that would operate on something like Safari. As we did the analysis, we weighed the benefits against the two technologies heavily, but we quickly found that moving the specific functionality targeted for our solution, again to the physician, to a native application made great sense, and here's a couple of reasons why. One of the first areas of focus was on device integration, which arguably extends to the integration of the Apple ecosystem, or the ability to deploy our solutions via the Apple App Store and iTunes. So Apple has an App Store. What's the value? I mean, why not just create a browser-based application and avoid the App Store altogether? We had to wrestle with that. And as we learned more about what Apple does and the manner in which they operate the App Store, we found that the process by which vendors submit applications is inherent with safeguards and protections that limit exposure to the non-Apple community, thereby limiting the likelihood of viruses or hacks from the outside, which was fairly significant in our decision making. In fact, part of the application process to Apple is an integrity check that Apple performs in an effort to ward off vulnerabilities that would lead to hacks and possible data breaches. So we felt that this level of added security was beneficial that a browser solution would necessarily not provide. Next, it provides flexible synchronization with server-side infrastructure to ensure that our information continuity remains intact at all times. And because the application runs on the local device, we minimize traffic to and from the servers, which improves the overall performance to the end user, which of course is the physician, and is pretty important. Next, the device-side applications provide a device-level security, a login, coupled with efficient and secure setup of accounts that we can install within the device itself or within the application itself, all of which are designed to ensure a layer of security against accidental or unwanted access. Additionally, there were features inherent within an iOS application that we wanted to leverage as well, this is one of the biggest benefits, such as the ability to push badge notifications to the end user to improve efficiency. These badge notifications, as you see on the slide there, they of course notify the user when there's an actual work to be done by providing a graphical display on the device itself. And finally, we were able to leverage device-specific functionality like Siri speech-to-text, which is particularly useful when considering text entry on missing text or signature deficiencies that we talked about earlier, versus the use of the onboard keyboard, which is somewhat unwieldy specifically on the iPhones and the iTouch. We're in the process of looking at other applications that leverage functionality on the device itself, such as device-side GPS, use of the camera, and other device-specific features that are yet to be developed. So similar to badge notifications, we were also able to utilize the push notifications inherent within the Apple device. Here we are focused more on the ability to send text-based alerts with sound and vibration if desired, as well as the ability to send text messages to end users. The main benefit, of course, is the added capability to let physicians know that they have work to perform. Not a bad feature when you consider the alternative is to call them and remind them that they have work, something that the HIM professionals avoid but are really forced to do without a feature that adds this level of push to the end users, the physicians. Again, our goals were to focus on the ability to improve the overall performance of the physician as it relates to the revenue cycle, and as you can see, these features dramatically improve upon the physician's productivity by letting them know that work exists. Next, we wanted to ensure that the user experience was simple and easy to understand and quickly to be adopted by our physician users. In order to do this, we contracted with an outside human factors and graphics design company that specialized in the development of applications designed for mobile phones and tablets where the real estate for the application is significantly constrained. As this phase of the project progressed, the constraint that we provided to this vendor was that they had to develop a user interface for our application that required absolutely no help file and no user manuals. In other words, the user interface had to be so incredibly intuitive that a physician user, could quickly and easily become proficient with the application in a very short amount of time without the need for a manual or any training. Based on our customer feedback, we've seemed to accomplish this goal, and to this day, we still do not have a user manual for our solution. Finally, because we were going to be displaying patient information on the mobile device, we had to be mindful of the protected health information, or PHI, as it's come to be called. For this, we delivered a requirement that prohibited the storage of any and all PHI on the device to prevent accidental disclosure or breach to persons other than the intended physician. In order to do this, the requirement was that all user activity had to reside in volatile memory or RAM and could not at any time be stored on the device local drive. So from an application perspective, we had to ensure that we accommodated user authentication guidelines, the use of Active Directory, and we had to ensure that we were honoring device timeouts without the ability to access PHI with a simple device logon. Additionally, we had to ensure that in the event of a loss or a theft of a device, that no information was able to be extracted from the local data store by those that obtained the device inappropriately. So with all of that said, I want to briefly introduce you to the McKesson mobile solution that I've been discussing. The solution is, of course, Horizon Patient Folder Mobile Deficiency Completion. If you go to the App Store, you'll find it as HPFMD. So let's look at that. So as I mentioned, the solution is designed to be a single application supporting a single physician that has admission privileges to one or more hospitals that utilize McKesson's patient folder application. The application supports the use of in a multi-facility environment, and when this is the case, the physician configures their logon credentials to each of the facilities, which are all likely different. And the application also supports Active Directory for each of those facilities, creating administrative simplification when managing user access. From a workflow perspective, the application supports the ability to complete all forms and documents and all of their associated deficiencies. And this includes the signature deficiencies, the missing text, and the dictation deficiencies that we discussed earlier, all in an intuitive, easy-to-use interface that puts access to the entire chart at the physician's fingertips. Physicians also have the ability right from within the application to drill into the current patient encounter, view past encounters, and review the documentation associated with each, all secured by the physician's access credentials defined within Patient Folder. So this capability puts access to the patient's chart in the hands of physicians when they need it and where they need it, regardless of where they are. And again, this is the significant need for this functionality was defined by our customer interactions with the physician groups of users, something that, of course, I'm a huge proponent of. Finally, when viewing the documents in the patient's chart, the physician is rendered an extremely intuitive user interface that is designed to mimic the look and feel of an actual patient chart, but obviously without the paper. A physician can review past histories, medications, results, progress notes, discharge summaries, and instructions, just to name a few. Again, all of this is provided without the need for a user manual or help file, and all the access is intended to be intuitive enough for a physician to navigate the application by what seems to be the right function without having to consult a manual. So when the physician deployment, from a physician's deployment perspective, we also provided a lot of scrutiny here as well. From a flow perspective, the physician will be happy to know that the client-side application is available for immediate download via a free application, stress that it's free application found on the Apple App Store. The small optimized application loads quickly, and once they have it, an intuitive account setup screen allows them to configure their application per facility. And once the chart analyst creates a deficiency, the physician will have immediate access to not only that deficiency, but the entire chart for the patient. And of course, the end result here in step 4 is a happier physician community that is now free to utilize their time with greater flexibility than ever before. So with that, that concludes my remarks on my particular portion of the presentation. I'll now turn it over to Sean Curtis, who will pick up with the Formfast solution.
All right, thank you, Patrick. My name is Sean Curtis. I'm a solution architect for Formfast, and I'm going to cover a little bit different topic around electronic signatures, mobile electronic signatures, and an enterprise strategy. And what Patrick talked about was the persona of the physician, and we're going to look more at what happens in registration and interacting with the patients that are going through the organization. So a little bit about Formfast and who we are. So Formfast is a software company that's been in the healthcare business for over 20 years, exclusively focused on healthcare. We provide enterprise eForms along with workflow management software that's not just about forms, but actually enabling processes across your organization. We have over 1,000 customers in healthcare, and we're deployed across a wide range of systems. So we're enabling products like McKesson's HPF as far as getting content into that product or other products, EMRs, and the like. The solutions that we offer are basically a culmination of output management and the workflow involved with that, along with electronic signatures and automation and integration between your applications in your organization. So starting with output management, we work behind the scenes to understand the data that's flowing across your organization and then trigger events to occur based on that information. So a common example is registration. Rather than having your people who are at the registration desks have to understand the rules behind generating documentation for a patient as they come in, the data can tell our system what those patient's demographics are and then generate documentation for that patient specific to that visit and that encounter. That helps you make sure that you're capturing all of the documentation for the procedures that you're going to perform, all the consents that need to be signed before they can be signed. And because we integrate with the EMR, that information, once it's passed through our system, is going to pass directly into the EMR system and be available site-wide or enterprise-wide so that everybody has access to it. So again, that's just an example of the common goals of moving to an EMR, allowing Formfast to provide the support to move to that EMR by centralizing and securing your records, being able to share information across your departments and locations in real time. As soon as it's collected, it goes out into the EMR and it's available across the organization. Also then having the records for regulatory and compliance needs, understanding that we also have workflow solutions that maybe are clinical or maybe non-clinical for approvals and requisitions. We work in that area as well so that you can gain faster approvals and ensure that your organizational policies are followed. So we have business rules built into the back end of the solution that you can manage and maintain and ensure that your policies are followed through that. And specifically what I'm going to talk about today is with the electronic signatures. We can control the electronic signature event for your patients and for your consent forms and records and actually add things that are required to that document before it can move forward to the EMR. So we're going to talk a little bit about the context for mobile and our value proposition around that. We're a Reliable, proven solution, like I've talked about with the over 1,000 healthcare customers already. Cost effective, we're quick to deploy, and I'm going to talk about some of the deployment options for electronic signature in a minute, and you'll see what I'm talking about. Flexible options for licensing and deploying and rolling this out to your end users. And it's an extensible platform, meaning that we can build on what we already have to grow your solution. So you can start small in one area and grow that out to your organization. We have process improvement expertise. So what we really are is a workflow consulting organization too that can help you look at your current state and your goal and get you to that future state through different solutions of process improvement, different methodologies. And again, the healthcare focus that we have means that we are solely focused on the personas in healthcare, and our technology is built around just those focuses. So what we're doing with mobile and why we're doing it, mobile healthcare is maturing. It's really on the cutting edge right now. It's coming out very rapidly. Recently, HIMSS did a survey and a report that shows that 68% of hospitals are formalizing their policies, and 36% are starting to allow patients and consumers to access information via mobile devices. Some of the things that Patrick talked about too was the debates around bring your own device. That type of activity is really showing that there is a push in the organizations to start adopting these mobile devices and start moving towards this method. But that also leads to a lot of challenges. So we understand that people in their personal lives are starting to use these devices, whether it's their phones or their iPads or their Android tablets. They're starting to organize everything in their lives around mobile applications in some cases. So that puts challenges on IT for the request for purchasing these devices, or maybe not purchasing to support devices that their staff is bringing into the organization. That puts a lot of strain on an organization. So that's why these policies, what we saw, 68% of hospitals are starting to build these policies. They have to get ahead of these challenges by defining what they're actually going to do. There are also new vendors that are coming into the market to present mobile-only solutions with varying success, with varying integration in the back end. So an advantage of working with a McKesson or with a Formfast is having that maturity of a vendor who has a focus in this area, who has a back-end solution that now has a new front end for the mobile devices. And of course, there's always going to be the privacy and security issues with various devices, various platforms and technologies. And vendors across the board are still sorting out how to interoperate and how to work between applications on these mobile devices and how that all works out. So standards are still evolving there. And so that's just a few of the challenges that we address with our solutions. So our strategy overall is to support a wide variety of mobile hardware. So Android, iPads, tablet PCs even, and provide a seamless transition between your hardware and your mobile devices. So we don't want to add complexity to IT and add maintenance and add training responsibilities to your IT department. We want to be able to fold those in nicely together so that you get a product that you can support and transition between one platform and another without a lot of overhead. And leverage what we have for standards in web-based solutions for protecting your PHI, protecting access to information. And of course, our mobile strategy is to move towards providing gap workflows or workflows that fill the gaps between solutions that are out there that may not be existing today in those core solutions. So one of those, of course, is electronic signature for patients, where the patient isn't a registered user of the system. And so it requires a different set of features than an electronic signature for a physician to use, who is a known user of a system and has credentials within the system. So then, taking advantage of some of the things that we have on these mobile devices is going to be important going forward as well. That voice recognition and cameras and barcode readers, so that we can speed the use of these, make it easier for people to use those without having to use the soft keyboard or to use external devices, or to actually introduce the possibility for human error where they're keying in information where they could actually scan a barcode with the device. And we're continually re-engineering and moving more and more of our products towards the mobile platform. So just an example of one of the things that we offer is the mobile forms on demand. Basically being able to have a piece of the Formfast software that would typically reside at a nurse's station where they're generating documentation, maybe at shift end, or maybe reprinting of wristbands or patient progress notes. Now we can take this to a mobile device, and if any of you are familiar with mobile devices, sometimes there's a little bit of a problem with direct printing from mobile devices because they're not attached to printers. Formfast helps to alleviate that by using a forms on demand solution, so that you can select a patient, select a packet of forms, and it's all handled through the server side of generating those documents if you want to generate those. The other part of it that is more the subject of today's session is the electronic signatures. And what I'm going to talk about is the traditional electronic signatures, the mobile electronic signatures, and then an enterprise strategy for e-signatures. Because as you'll see, every location could be different, and it's going to take a blend of traditional and mobile e-signatures to really meet the needs of an organization. So with traditional electronic signature, what you're seeing here is a registration station and a patient and a registration clerk basically tethered to this desk, and everything is happening here. The patient is holding a stylus with a signature device. They're viewing their form that they're signing on the screen, and the registration clerk is able to guide that process. The mobile signature solution is anywhere. You see it can be pulled out of the pocket of the physician's coat. It can be carried with you to the patient's bedside. It can be reviewed anywhere you want within your organization. So it really breaks that tie to that desktop and makes you mobile, of course, and lets you move throughout your organization with that information. Traditional electronic signature is going to be tied to various capture devices, methods of capture. So a PC tied to a signature device, something that lets you use the stylus, and that can be in some cases what I have here are Topaz devices, and also tablet PCs, writable screen monitors. There's a variety of different devices, but most of those are going to be less mobile, more attached to either a desktop or a wireless on wheels type of a solution. The mobile e-signature, on the other hand, has a different set of devices. It's a single standalone device like an Android, an iPad, a tablet PC that takes, goes where you go and is all in one type of a device. You can sign it with your finger. You can sign it with a stylus. So I'm going to talk a little bit about the features of traditional e-signature just so we can set the baseline. And then we'll talk about how that translates into a mobile e-signature, so you can see the differences and the similarities. Again, traditional e-signature is something that occurs at a desktop. It has a variety of different field types and different features available. So as a registration clerk, you would see basically your stack of forms that need to be signed, and then all the signature areas that are available for signature. And you can move through that process and push those to your patient, who is seeing just the form and the signature areas and the annotations as they're applied to the forms. So some of the things that we support are signature fields, of course, and then there's also fillable fields. So if your registration system doesn't pass all of the information needed to complete this document, inside of the signature client, you can fill out that form with any missing information. A lot of cases, the registration system may not know who the witness is for the signature, or some specific data elements on this form that isn't captured in that registration process. So another part of it is allowing for check boxes. So you can go through a process of asking the patient questions, checking off those boxes, so you capture that information for your compliance needs. And then there's also the security or the process control of requiring fields to be signed before this will move on to your archiving solution. So the field there in red is a required field, and we're able to make sure that that gets signed before moving it forward. We also have an option for self-signing, so that rather than passing a device back and forth, the patient can have the device, sign it by hand, and the registration clerk can self-sign, which basically does an electronic stamp of the signature onto the form. Because they're a known entity, they're a registered user, we can do that, whereas the patient, we need a physical signature from them. So this is just showing a physical signature being collected through a signature capture device. It goes onto their form, whereas we have the electronic signature from the registration clerk. What that looks like to the patient, it basically gives them a prompt on screen, and they sign it. They have the ability to clear it and okay that as well. And in real time, as they're signing that, it shows up on the screen so they can see exactly where their signature is being applied to that form. So how that can work on mobile e-signature is basically the form, the document is presented, and all the signature documents, be they consent forms or what have you, are presented on the iPad. And then as you scroll through that document, you would see the signature areas in blue. And then just tapping on that signature area is going to bring up, it actually enlarges because this is smaller than an actual form slightly, but it's also a little bit hard to sign with a fingertip or a stylus on the mobile device. So what we do is we blow that up so that the patient can then apply their signature to that rectangle and then accept that signature, and it applies to the form itself. So for each signature area, you can do that. And of course, if there are required signature areas, we enforce that process as well on the mobile device. Once they're done, then that pushes right over to the EMR. So now it's archived and it's available to the rest of the organization. We also support the annotations that we talked about with the traditional electronic signature with the mobile electronic signature. So as I tap into a field that is for text input, the soft keyboard comes up and I can key into that. With check boxes, I can also check each of those check boxes by tapping on those. So basically with these two solutions, we're supporting the same core set of functionalities, but in different formats. So you can do this in different ways. So for an enterprise organization to roll this out, we are providing the options for doing both. You're going to have some static standalone signature stations for registration, but you may have a different solution in your emergency department, or you may have a different situation in maybe a surgery suite where you need to move to the patient bedside for some of these consents. So that's why we support this variety of solutions. And we also provide the ability to simply implement one solution and manage and maintain one solution, yet access it through these different interfaces. So once you have these two solutions in-house, basically it's one set of management and maintenance. It's the same forms on either device, or either solution can support the same back-end solution. So you don't have to maintain a mobile solution and a traditional solution. You're maintaining one solution. We just provide two different windows into that solution for you to use. So that's kind of the enterprise view of it, is being able to provide different solutions, different devices in different areas to meet those needs of those users. So one of our use cases is Broadlawns in Des Moines, Iowa. They're a very progressive organization. It's a 200-bed facility. They also have 30 clinics, but they've managed to achieve the HIMSS Stage 7. So, and also their adoption of technology has won them an award for the most wired hospitals in 2011. But using technology and combinations of technologies from different vendors, they've been able to reduce their medication errors by 70%, adoption of CPOE rates over 90%, BMV rates over 90%, CCD exchange, NCQA patient-centered medical home certification. So they've done a lot of progressive work at their organization. They've achieved a lot of things. And on the left side, you see that they've also implemented quite a broad suite of the Formfast technology. Output management, e-signature solutions, workflow automations, content management, and mobile e-signature and forms on demand. So they've been able to implement these to support their common goals and move up that scale of the HIMSS stages to get to the Stage 7. And Broadlawns is just one of the customers that will be at HIMSS in the next week to talk about their use case. So that's one of the organizations you'll be able to talk to in person at our booth at HIMSS. So some of the benefits of providing an electronic signature solution with Formfast is, of course, improving your patient experience, so letting signatures go to them, or if that's the case, or speeding signature capture at the point of registration and speeding patient care by having that on file, reducing your needs to print anything. That's going to save your organization time for having to re-index that, scanning that, and retaining that paper document that you printed. Of course, provides for your process standardization with the required fields, and of course, each of these consents is generated based on patient demographics. So you'll have different consents and different types of documents that are generated based on the demographics of your patient. So you're assured to get the right documentation for each visit. And then, of course, making sure that this stuff is signed and then directly imported into your EMRs. That's there for audit support. It's there for compliance. It's there so that every user who needs to see that has access to that information. So it's no longer in a single paper chart. That's the advantage of the MR. We're getting rid of that single paper chart that has to be requested and physically moved. It's there available across your organization. So that's a summary of the Formfast, e-signature, and mobile solutions for hospitals. And with that, I'm going to turn over to Margie to talk about next steps.
Hello, everyone. This is Margie Driscoll, Product Marketing Manager for McKesson. If you would like more information about the solutions you heard today, you may visit McKesson and Formfast at HIMSS, which is only 10 days away. For information about McKesson's presence at HIMSS, please visit mckesson.com/HIMSS13. Formfast's booth is 8247 Kiosk 24. And for solution information, we each have websites you may visit at mckesson.com/HPFMD and formfast.com/eSignature. I'll now turn it over to Eric Wicklund, our moderator, to start Q&A. Thank you.
There's a question for Sean in here. Many of our webinar attendees have found mobile technologies useful in certain but not all areas of the hospital. What role do you think mobile will play in the future in the organization as a whole?
Well, as I mentioned, it's the users that are really pushing mobile into organizations, and with bring your own device and the real lifestyle of this next generation of users coming into organizations, it's going to be expected as a requirement for the newer doctors and for even as the patients would expect to see more mobility, more use of these technologies. And also the vendor interest is increasing too because of the new features that are available in these all-in-one devices. So this is exciting for vendors as well to move into this market and be able to provide some really interesting solutions for that. So as today, I think we're in a very young stage of the mobile adoption, but we're also in a very fast-moving time as far as the adoption of mobile technologies. So it'll come faster and faster as more and more vendors put out this mobile type solutions for hospitals.
Great, thank you. And here's a question for Patrick. About a quarter of our attendees believe various factors affect the healthcare adoption of mobile technologies, such as cost, security, and staff buy-in. What have you heard from customers or the market?
Okay. Let me try to answer that in a little bit of a reverse chronological order. Let me talk about staff buy-in, then security, then cost. Because I think the staff buy-in was one of the biggest hurdles that we had to try to overcome. And what we heard from our customers is that, yeah, it's a good idea to create a mobile device. We know that's an emerging trend in healthcare, but make sure that if you develop something, it's something that actually allows users to complete work. Don't make it a view-only solution. Don't make it information shareable. Just make it so that they can actually use the application to get work done. And so that's what we wanted to focus on. The value that we would then drive becomes measurable, which we'll talk about when we get to content. So the first thing has to be the value. The second thing around security, I think most of our customers there's a variety of security paradigms or security limitations that our customers have. And so as we go to market with a solution that extends the access to protected health information via a mobile device, which is predominantly going to expose that information in a way that a lot of our customers may feel uncomfortable with, we have to be able to provide a very flexible security capability in terms of being able to adapt to what the customer security requirements are. Some are going to expose servers into the what's referred to as the DMZ. Others are going to keep everything protected behind a firewall. And if there is any type of exposure to the direct internet, how do we secure that? And we have to provide those options, which we do. The next thing is around securities of the PHI and the information that's stored on the device when in use. So and I think we talked about that in our conversation. But all of that then must somehow relate to some sort of return on investment that says we're going to spend money to save money in our organization. So we're going to invest in this technology, we're going to invest in the product, and we expect it to return these results by making our physicians more productive, access to their documentation when and where they need it, and complete their deficiencies faster than what they would have otherwise. And all of that really should be wrapped in some sort of analytics that helps us to use that data to help justify the expense in our product. So all of those things are great pieces of information that we get from our customer. We factor that into the backlog of requirements. We're actively working on most of those we already have. Some of the analytics components we're adding. We wanted to make sure we had some use in the market before we go back and build the analytical scorecards. But I think from a cost and security and a staff buy-in perspective, that's how I would address that.
Great, thanks. Another question here for you. This will be the last one before we wrap up, because we're nearing the top of the hour. But what are payers doing about mobile? Are payers ahead of providers in driving consumers to adopt mobile for remote monitoring, or just self-help?
A good question. I don't know that I'm qualified to even answer what the payer space is doing. We don't really focus in on it much. so I don't know much about what payers are doing. The payer side of the equation is something that we interact with limitedly within the business office, but we're not aware of any mobile devices that are being pushed into our customer base specifically from the payer community.
Great. Well, we're at the top of the hour now, so we'll go ahead and conclude this webinar today. Thank you to today's presenters and attendees for joining us. If you would like to view an archive of this webinar or share it with a colleague, please visit the on-demand webinar section on healthcareitnews.com, hims.org, or mhims.org. Thanks again, and have a nice day.